All right, let's get straight into this. So what we're going to do is going to test your cranial nerves. There are 12 cranial nerves from your neck upwards, so we're just going to check those out for you. But first of all, what I'm going to do is I'm going to just see what we are working with here. And we're just going to check your face symmetry to begin with. So there you go. Yeah, if you can keep your head absolutely still for me. That's good. That's fine. Let's just feel around just underneath your chin. Okay, good. And I'm just going to have a feel around the back of your head. Yep, that is perfect. Good. All right, that's fine. So, what I'm going to do next is just going to cover up one eye, and we're going to check first of all your vision, and just going to cover one eye like this. Now, I want you to tell me if you see my fingers wiggling. If you look straight ahead towards me, if you look at the bridge of my nose just here, and tell me when my fingers wiggle. Okay. Good. 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 Perfect. Okay, we'll try the other eye now. So, if you look again just at the bridge of my nose, and we're just going to cover up that other eye. And again, same thing. Tell me when you see the fingers wiggle. Okay, perfect. Going to do the same thing now, but with both eyes open up. Man, it is hot, isn't it? AC is broken down, so I'm so sorry about this, but we'll make it as comfortable for you as we possibly can. So if you look again just at the bridge of my nose, just here, and tell me when you see my fingers wiggle. Perfect. Perfect. Yes. Good. Good. That is fine. Okay. So next, we're going to do much the same thing, except this time I'm going to get you to follow the light for me. So again, keeping your head still, just going to cover up your one eye. And if you can look at the light for me, just follow the light with your eye. Good. Perfect. Yeah, that's good. All right, same again. Whew. All right, if you can look at the bridge of my nose again for me. Do the same again. There you go. Just follow the line. Yes, good. That is good. All right. And same thing, using both eyes together. So looking initially just at the bridge of my nose, just to get your head nice and straight. That is perfect. All right. Now, if you can look at the light for me and just follow the light. No, if you keep your head nice and still, that's it, as though you're looking at me, but just with your eyes, if you can follow the light. Yeah, good. Perfect. Perfect, 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 perfect. That is brilliant. Good. So we'll just check your convergence now. So keeping your head nice and straight again. if you can look at the tip of the pen, just here, and keep your head nice and still, and if you can follow the pen for me, keep looking at just the tip of the pen. That's it. So keep looking at the tip of the pen. Keep looking, keep looking, keep looking, keep looking, keep looking. Perfect. Yeah. So far, so good. Okay. All right, so again, I'm just going to touch your face, and I'm going to get you to just close your eyes. And I'm going to touch your face, the same part of your face on each side, and I want you to tell me if it feels different on either side. Okay? So again, eyes closed, that's it. And I'm just going to feel your face and tell me if it feels different on either side. No? Okay, your forehead. Perfect. Down to your chin. Tell me if it feels different at all. Okay. Either side of your ears. That is great. Didn't feel different on either side. About the same kind of pressure, yes? Excellent. Good for you. Okay, so what we're going to do next, along the same kind of lines, we're going to do sharp and dull. So on your face, if I get you to shut your eyes again, I'm going to either touch your face with the end of a Q-tip, or this little guy here, a little bit sharp. It's not sharp, but you can tell the difference between the two. So if you can shut your eyes again for me, keep your head still and relax. Good, good. And tell me whether you feel sharp or dull. Okay, good. Sharp or dull. Sharp or dull. Sharp or dull. Sharp or dull. Good. Sharp or dull. 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 And sharp or dull. Sharp or dull. And sharp or dull. That is perfect. Good for you. You're passing with flying colors so far. So what we're going to do next is, again, I'm going to get you to shut your eyes for me. Now, what I'm going to do is, before you shut your eyes, let me just show you. This has been in the fridge. It's really cold, which is beautiful on a day like today. But what I'm going to get you to do is to shut your eyes, and I'm going to pop this against your part of your face, and it's your job to tell me whether you feel the cold. Okay, so if you can shut your eyes for me and tell me where you feel the cold, whereabouts on your face. Yeah, good. Good. Perfect. 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 Okay, good. All right. You feel the cold? Yes, that is great. All right, so going back to your eyes, what I'm going to do is just have a closer look at your eyes, and we're just going to check, first of all, that your pupillary reflexes are working well. So open your eyes and yeah, that's good. All right, so I'm just going to pop my finger in the middle here. Okay, direct, consensual. Direct, consensual. That's fine. We'll just do something called a swing test now. And what that does tells me whether there's something called a relative afferent pupillary defect. That is, if your pupils dilate and constrict at the same rate at the same time. So if you can look just to the bridge of my nose, just here. That is as perfect as it gets. So, all right, so I'm just going to have a closer look at your eyes now. And what this does, this is an ophthalmoscope, this little guy here, and I'm going to shine it in your eyes, and it gives me a view through the anterior chamber, through the cornea, the anterior chamber, right back through the vitreous chamber, right to the retina, the back of your eye and your macula, and the surrounding area, just to check that everything is as it should be. So, let's check that this is on properly. Man, it is too hot today. Okay, so if you can look straight ahead from me, somewhere about there. There you go, good. And yeah, good. Uh-huh. Perfect. Anterior chamber is fine, and looking through the vitreous, everything is good. And looking at the retina, everything seems a-okay. Okay, good. If you can look into my light. Yeah, good. Sorry, that's a little uncomfortable. But just do the other eye now. So again, you look straight ahead for me and try not to look into my light just yet. Okay, corneal reflexes, good. Aqueous is good. Alrighty. Vitreous is good. And just checking out your retina, everything is nice and pink and nothing untoward there. Okay, good. If you could look into my light, please. Yeah, that is fine. Excellent. Okie doke. Let's check how we're doing. Okay. How are you feeling? You feeling okay? It is very warm, I'm so sorry. So, let's see what we're going to do next. Now, what I want you to do next is, if you can, just going to pop my chin underneath your jaw here, and I want you to clench your jaw for me. Okay, good. And relax. And clench it again for me. Perfect. Good. All right, now I want you to clamp your mouth shut like that. What I'm going to do is I'm going to put my hand on the top of your head, and with my other hand underneath your jaw, I want you to try and open up your jaw for me. Yeah, I'm going to push back. So if you can fight me, fight it. Yeah, that's good. And if you shut your jaw again, and if you can clench again for me. All right, perfect, good. I'm going to do the same kind of thing this time. This time, I'm going to put my hands underneath your chin like this, and I want you to try and move your chin downwards. If you can fight against my two hands here. That's right, fight. Perfect. And both hands on top of your head. If you can try and lift your head up for me. Yeah, fight. Yeah, that's good. All right, and what we'll do next is I'm going to put my hand up to the side of your face like that, and I want you to turn into my hand on this side of your face, okay? So if you can turn into my hand, and again, I'm going to fight you. That's right, try to keep turning. Perfect, good. Going to do the same with the other side. So if you can, that's right, turn into my hand, try and turn your head for me. Okay, yeah, and it's fine, good. Okay, so this is the fun part of the test. Now, what I'm going to get you to do is to pull some funny faces for me. So, what I want you to do first is to raise your eyebrows as though you're really, really surprised at something like this. Yeah, that's good. Open your mouth nice and wide. Like that. Good. All right, that's fine. If you can smile for me, show me your teeth. Yeah. Frown. Okay, good. Can you puff out your cheeks for me? Can you go? Yes. Yeah, that's fine. And if you can now roll your tongue. You roll your tongue for me. You don't need to do that. That's okay. That's good. All right. And what I'm going to do next is, if I get you to hold your hands out for me like this, as though you're holding two kettlebells or like a board or something. If you hold your hands out like that, perfect. Now, what I'm going to do is I'm going to press down against your hands, and I want you to try and resist. Okay, don't let me push them down. Okay, so there you go. That's fine. Yes, nice and strong. Okay, that's good. Now, if I get you to keep looking straight ahead for me, look somewhere off into the distance, just here. And what I'm going to do is I'm just going to tap your forehead. Now, what I want you to do is, if you can not blink when I tap your forehead, okay? So keep looking ahead for me. Okay, blink away. Excellent, good. Perfect. Okay. So far, so good. We're going to do the auditory part now. We're going to check your ears out. So what I'm going to do is I'm going to come really close to you. I'm so sorry. I'm going to whisper something in your ear, and I want you to tell me what that something is. Okay? So, keeping your eyes closed, I'm just going to come up and I'm going to whisper some numbers. So, 1, 17, 36. Can you tell me? Yes, good. Okay. Same thing on this side. 43, 89, 52. Again? Yes, all right. 15, 12, 92. Yeah, perfect. And 59, 27, 17. Yeah, perfect, good. Keeping your eyes shut for me, I'm going to make a sound on either side of your ears. Now, if you can tell me when the sound goes away. Okay, so shut your eyes. Perfect. And you hear that? Okay, tell me when it disappears. Good. Okay. Do one ear at a time. So I'm just going to cover up this one ear. And same thing on this side. Tell me when the sound disappears. Yeah, good. Same thing on the other side. Yeah, that's fine. Good. So, I've got this little guy here, tuning fork. So what I want you to do is, keeping your eyes shut again, I want you to tell me when the sound, the vibrating sound, disappears. Okay? So, keeping your eyes shut, and we'll do one side at a time. So tell me, eyes shut. There you go, good. Tell me when the sound disappears. Oop, try again. Okay, good. Same again on the other side. So, you ready? Okay, good. Yeah, that is perfect. Good for you. See how we're doing. Okay, so we're going to do a very, very, very quick smell test. So I have a range of bottles here with different smells inside them. This checks your olfactory nerves are working okay. So tell me what you think this smell is. Yeah, mint. Perfect. Okay. And the smell. Citrus. Yes, good. Okay. And this one is a little bit difficult, but tell me what you think this is. Strawberry. Yeah, good for you. 100%. You've done so well. Good for you. So, one last thing I need to do just to check your scalp to see if there's any lumps, bumps, or scratches. So, oops. All right, so I'm just going to reach around just here, and I'm just going to have a feel of your scalp. Okay, and this tells me if there's anything unusual going on. I'll just feel around the back of your head. Yeah. Okay, good. Just feel around your ears, just going to scratch your ears and you tell me whether there's any pain or discomfort or anything. So, okay. Okay, comfortable? Yeah, that's fine. You did excellently. You've passed 100%. No problems there at all. Your cranial nerves are working very, very well. If you enjoyed this experience today, what I want you to do is to see that button over there. It says subscribe. Just punch that button over there. This one. Just over here. Just over on this side here. You see it? Just there. And we'll see you again next time. Alright, so let's get started. And we're going to be checking your eyes today just to make sure that everything is a-okay. So what we're going to do to begin with is I'm just going to have a look just at what we're working with. So I'm going to come in a little bit close. Sorry about that, but just need to have a look at the basic symmetry and state of both of your eyes. Yeah. Good. Nice big eyes. So, if you could look up for me, I'm just going to bring your lids down just a little bit, just to have a look. See. Nice and pink. Good. And if you can look straight ahead for me, and now if you can look down, I'm just going to lift your one lid up. Yeah, good. And look straight ahead again for me, and look down. And I'm just going to lift your lid up a little bit. Yeah, that's good, nice and healthy. Okay, so what I'd like you to do now is if you can just blink for me, just like this. Nice and slow, like that. And if you can blink a little bit faster, like that. Yeah, that's good. And if you can blink once more and scrunch your eyes up for me. Yeah. Excellent. Good for you. Okay, now what we're going to do next is something called the cover test. Now what that does tells me whether your eyes are working well together, whether your binocular vision is on point. So what I'll get you to do is if you can look ahead for me, just look at the tip of my finger just here, and I'm just going to cover up your one eye. Okay, good. Keep looking at my one finger. Yes, good. All right. And we're going to do the same again with your other eye. So if you can look at my Other finger just there. Okay, good. And what we're going to do next is we're going to do different points of gaze. So if I get you to look at my finger here for me. Yeah, very good. Look at my finger here. If you can look at my finger just down here for me. Yes, very good. And look up here towards my finger. Keep your head straight. Yeah, just with your eyes, if you can look at my finger for me. Yeah, perfect. That's good. And if you can look now straight ahead, just at my finger again, and I'm going to just flick from eye to eye. Perfect. Perfect. That's good. If you can look now just at the bridge of my nose, just here for me. Oops. There you go. Keep looking at the bridge of my nose. Excellent. Good for you. Okie doke. So what we're going to do next is I'm going to get you to look at this here light. There you go, at the end of my torch. What I want you to do is, if you can just keep your head nice and still. There you go. And I want you to follow the light, but just with your eyes. Okay, if you could keep your head still, as though you're looking straight at me, which you would be anyway, and just with your eyes, if you can follow the light for me. And again, what this does is to check that your eye muscles are working well together, and one eye isn't drifting off somewhere into the atmosphere. Okay, good. Very good. That is perfect. Okay. Very good. Okay. Excellent. So, I'm going to have a quick look now at how you converge. So this checks that the eye muscles that make your eyes turn in, like when you're doing a near vision task like reading or looking at your computer or whatever, up close your eyes turn down and turn in. So this very simple exercise just tells me whether your eyes are turning in and converging properly. So if you can look at the tip of the pen here for me, keep looking at the tip of the pen, keep looking, keep looking, keep looking, keep looking, keep looking, keep looking, keep looking. Yes, good. All right, we'll do that once more. So if you can, keep looking at the tip of the pen for me. Keep looking, keep looking, keep looking, keep looking, keep looking, keep looking, keep looking. Excellent. That's great. Okay, so you'll have to forgive me. It is very hot in here today. The AC has decided to pack up on one of the hottest days of the year, but we'll keep going. So if I get you this time, I'm going to have a closer look at your eyes. So again, it's a little bit of a light, so it might be a little bit uncomfortable, but I'm sure you can cope. So if you keep looking straight ahead for me. That's good. Okay, yeah, you can blink as much as you want to. That is perfect. Okay, good. And just have a look now at your other eye. So again, if you can keep looking straight ahead for me. That's good. Let's just adjust that slightly. That's fine. Keep looking straight ahead for me. Okay, good. Yes. Yeah, you're doing really well. That is perfect. Okay, good. Alrighty, so what I'd like you to do now is if you could look up to the ceiling for me. I'm just going to pull down your lid and have a look. Just check that your tear film is okay. Yeah, have a blink. Okay, and look down. Look up again for me. Okay, perfect. Alright, and with the same eye, if you could look down for me, and I'm just going to lift your lid up just a little bit and have a look underneath the lid. A little bit uncomfortable. Sorry about that. Okay, good. Alright, have a blink. You okay? Great. Okay, so we're going to have a look at the other eye now. So again, if you could look up to the ceiling for me. I'm just going to pull your lid down just a little bit. Yeah. Good. And if you can look down for me, just lift up your lid. Perfect. Yes. That's good. If you can look at the lights to the end of the torch for me, keep looking at the light, keep looking, keep looking, keep looking, keep looking, keep looking, keep looking. Yeah, perfect. That's great. Okay, so what I'm going to do next is I'm just going to have a look. The outside of your eyes, perfectly healthy. Cornea nice and clear. Eyelids nice and pink and healthy. Eyelashes are good. No blepharitis going on or anything. But I'm going to have a look now inside your eyes through the cornea, aqueous humor, vitreous humor, right to the back of the to the retina at the back of your eyes. So if, again, it's a little bit uncomfortable with the light, but not too much. So if I get you to look just about somewhere there, and I'm just going to shine this light in your eyes just for a second or two. Okay, good. Yeah. And if you could look up for me. And if you can look over here for me, over to your right. And it's perfect, good. If you can look somewhere down there for me, that'd be good. I'm just going to lift up your lid a little bit, so keep looking down for me. That's great, good. Now this time if you can look over to your left for me. Yeah. Okay, yeah, you can blink just as much as you want to. Alright, good. And if you can look straight ahead again for me. And this time, if you could look into my light, a little bit uncomfortable. Yeah, that's fine, good. Okay, so I'm going to do exactly the same with your other eye now. So if I get you to keep looking straight ahead again for me. And again, a little bit uncomfortable. Okay, good. Alrighty, if you could look up to the ceiling for me. Yeah. Nice and clear. Perfectly healthy. Okay, doke, if you can look over to your left. Yeah, that's good. That's great, good. Okay, good. And this time, if you could look down for me, and I'm just going to lift your lid up again. So keep looking down for me. Mm-hmm. Okay, good. And this time, if you can look straight ahead again for me. And corneal reflexes, good. Crystalline lens, perfectly clear, no sign of cataract. Aqueous humor, nice and clear. Vitreous, perfectly clear. Okay, yeah, blink a couple of times. Okay, good for you. And retina, nice and pink and healthy. And if you can look into my light, yeah, macular reflexes as perfect as it gets. So, yeah, nice and healthy. That's good. Okay, so what we're going to do next then is we're going to check what you can see on this handy lesser chart, that I have here. So what I want you to do, you don't wear contacts or glasses or anything, no? Okay. Now what I want you to do is, if you could read the letters for me, and if you could start from the top, work your way down just to the green line. Okay? So yeah, next line. And the next line. And the next line. Good. Next line. Next line. And the last line just above the green line. Yeah, perfect. Piece of cake. Can you go below the green line? Because if you would, that'd be a world record. So yeah. And the next one just above the red line. Whoa, perfect. Good for you. That's 20/20 vision. Excellent. Actually, it's better than 20/20. You're actually getting 20/25. Or as we here in the UK say, you're getting 6/5 vision, because we work in meters and you guys work in feet. So let's just check your color vision now. So what I'd like you to do is, if you could look, there you go, there's like a circle there with a number in it. So can you tell me the number that you see? Yeah, good. How about that number there? Mm-hmm. That number there, and there, and there, okay, and there, and there, and there, and there. Yep, perfect. Color vision is on point. That's good. So what I'm going to do next, just to finish things up, I'm going to take a photo of the back of your eye using this very high-tech fundus camera that I have here. So there's going to be a bit of a flash, but again, if you've put up with the lights so far, I don't think you'll have any problem. So we'll do your left eye first. So if you can look just into the lens here for me. Okay, and we'll just get that lined up for you. That's great. Keep looking in the lens for me. Perfect. Good. All right, we're going to do the same with your other eye now. So look straight ahead to begin with for me. And okay, we'll just get you lined up properly. And if you can look into the lens just here for me. And in a second, there'll just be a little bit of a flash once I get lined up. Yeah, that's great. Good. Okay, yeah, those have come out rather well. So let's give you just a chance to recover. So I'm just going to, if you can look down for me, I'm just going to rub your eyes along the top eyelid just a second or two, just give them a bit of a massage. Okay, just get those that tear film flowing again. That's great, good. All right, feeling okay? Excellent, good. So let me just check that your photos have come across on the machine, and I'll show you what's up. Yep, got some good images here. So let me just show you. Hope the light isn't reflecting too much, but this is your left eye over here. Oops. There you go. And as you can see, nice and healthy. That white bit there, the yellowy bit on the edge, that's your optic disc. That's where all the blood vessels, nerve fibers enter the back of your eye, and that's looking really healthy. The dark bit in the center, that's your macula. That's where you see detail. That's looking good. Fundus is nice and healthy, nice and pink and healthy. And the blood vessels looking nice and smooth. And exactly the same for your other eye as well. So that could not be better. So that's great. So what we'll do is we will email you a copy of your results, including your retinal pictures. You can have your friends around to have a look and have a party, whatever you want to do. And we'll see you again in 6 months' time. If you enjoyed this eye test today, if you had fun, if you look over in the corner of the screen here, there is a subscribe button. So just give that a punch, and I'll see you again next time. Thank you. Bye-bye. Okay, so we're just going to mark out the topography of your face using this fine-tuned medical instrument. So looks like a Sharpie, it isn't really. If you can look straight at me, and what I'm going to do is I'm just going to put some dots on your face. Now, what we usually do is, and this just maps out the topography of your face, and it makes it easy for them next door for the facial reconstruction. So if you look at me, and if you look just at the bridge of my nose and try not to move, you can close your eyes if you want to. I'm just going to make some dots around the major parts of your face. Okay, good. Don't worry, you can breathe. Take a deep breath. Yeah, that's fine, good. Sit back, relax. That's great. All right, and keep looking straight ahead. Just going to dot, 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 dot. Around your brow line, and now just underneath your eyes. So keep looking straight ahead. And again, you can close your eyes if you want to, but keep looking, keep your face facing straight ahead, straight forward. Good. Dot, 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 dot. Good. All right. That's fine. And I'm just going to move around your mouth now. So that's it. If you lift your chin up just a little bit for me. Perfect. Good. All right. Keep looking straight ahead towards me. Okay, good. Dot, 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 dot. Okay, good. And if you can turn your head slightly to this side for me, that's brilliant. Good. And I'm just going to come around the edge of your face. Dot, 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 dot. That's good. All right. So far, so good. If you can lift your chin up a little bit for me, and I'm just going to work around your chin now. So perfect. And if you can turn your head just a little bit, so you're looking over there for me. That's great, good. And we're going to go around the other side of your face. So dot, Good. So far, so good. Okay. Okay, let's just make a couple of notes. Okay. That's good. So, what I need to do next is I just need to fill in the dots, fill in the gaps around the dots. So, again, if you can keep looking straight ahead, I know this is a little bit long-winded, but keep looking straight ahead towards me, and then we'll get to the measuring parts of this pre-exam. So keep looking at me. If you can look just at the bridge of my nose, and again, you can close your eyes if you want to. So keep looking straight ahead for me. Good. Dot, 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 good, and dot, 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 dot. That is perfect. Good. Okay. Now to the measuring bit. So if you can keep looking at me again, we're going to take a few measurements of around your face, and pass those on to the technician next door, and they can start your facial reconstruction. So, again, relax and keep looking at me. And what I'm going to do first is just to measure your eyes. So I'm going to use this instrument here. Okay. So again, if you can close your eyes for me. Mm-hmm. That's good. All right, we're going to measure now the length of your nose. So I'm going to measure from the bridge of the nose just to underneath the nose. So again, you can close your eyes if you want to. Perfect. Let's just check that again. That's great, good. And what I'm going to do next is to measure between the inside parts of your eyebrows. So keep looking straight ahead. Good. Yeah, that's fine. Let's measure now the total length of your face. So that's right. Just keep still for me. Keep still. Keep still. Good. Okay, just check the other side is symmetrical. That's fine, good. Okay, so let's just measure your mouth now from each side of your mouth. So just relax as if you're going to sleep. Perfect, good. Next, I'm going to measure from the corner of your eye down to the corner of your mouth. So, same again on the other side. All right, that's good. Let's measure your forehead. So, okay, if you try and keep still for me, that's great, good. All right, keep looking straight ahead for me. Perfect. Let me just measure now the distance from this bit of your jaw here right to the edge of your chin. So if you can kind of go like that for me, yeah, that's good. That's fine. Going to do the other side now. So if you can turn your head for me, perfect. You've got it. You're way ahead of me. Okay, good. Now this time I'm going to measure from here to here. So what I need you to do is I need you to lift your chin up just a tad for me. That's good. That's fine. And we're going to measure now from the outside of one eye to the outside of the other eye. So, okay, you're doing very, very well. Okay, that's great. What we'll do next is I'm just going to measure from the edge of one nostril to the edge of the other nostril. Okay, good. It's a bit ticklish. I'm sorry about that. And from the bottom of your nose to the top of your mouth. Okay. Let's just try that again. Okay. So far, so good. Just going to take a couple of notes. All right, so far so good. You're looking perfectly normal so far. So I'll take another couple of measurements now. So this time we're going to measure from the top of your ear to the bottom of your ear. Okay, this is a very important measurement. So if you can turn your head a little bit this way for me. That's great, good. All right. And if you turn your head a little bit that way, do the other side. That's great. Okay. So what we'll do next is we'll measure from the eyebrow to the bottom of your face, just about there. So, okay, good. Just do the other side. Okay. That's great, good. So, just take that again. Okay, good. And the last measurement we'll take is just take the pupillary distance, the distance between your two pupils. But so far, everything is very, very symmetrical, and I don't think there'll be a problem with the operation. So if you can keep looking straight ahead for me, you can blink as much as you like, but we're just going to okay, 63 millimeters, and that is you done and dusted. So I shall So I'll pop all your details next door, and we'll see you again in 6 months' time. Thank you. Bye-bye. Okay, so we are going to be doing an ear, nose and throat exam for you today. How are you feeling? Good. Okay, so first of all, what we'll do is I'm just going to check the quality of your hearing on both sides. So what I'll get you to do is, if I get you to shut your eyes for me, and if I get you to raise your hand on the side that you hear my fingers. So if you can shut your eyes, there you go, good. And raise your hand. Perfect, good. And can you shut your eyes again for me, and raise your hand. Okay, good. Keep your eyes shut and raise your hand. Perfect. And once more, if you can raise your hand for me. Yeah, that's good. All right, that's fine. So what we're going to do next is we're just going to check the integrity of your ears. So I'm just going to be checking the cartilage on each side as we go, and checking for any signs of flakiness or redness Okay, good. Now what I'm going to do next is I'm just going to reach behind the ear on this side, and I'm going to press on the mastoid process just to check for any tenderness on this side. So if I press in just behind the ear, can you tell me, do you feel any pain or discomfort? No? All right, that's good. So I'm going to press in now just about here. We're going to check for some tragal tenderness on that one side. All right, so if I have a press around on that side and you tell me whether you feel any pain or tenderness. No? Perfect. All right, that's good. So we're going to do exactly the same on the other side now. So I'm just going to check first of all any signs of redness or infection. And what we're checking for is checking the cartilage of the ear. And we're checking for any battle signs or ecchymosis on this one side. Okay, that is good. Perfect. Okay, and again, I'm just going to reach just behind the ear on this one side. And you tell me if I press and have a feel around the mastoid process just behind your left ear, and tell me if you feel any pain or discomfort. No? Excellent, good. And we'll check the tragal area. So again, same thing, and I'm just going to press on the tragus, and you tell me if you feel any pain or discomfort. That's good. Okay. How are you feeling? So far, so good? That's great. Okay, so just give the ears just a little bit more of a palpation rather. Keep getting those two words mixed up. On each side, and you tell me if you feel any pain, discomfort, tingles. That, my friend, is perfect. Okay, so what we're going to do next is we're going to have a look inside your ears with this little guy here. Now this is an oscilloscope, and this is going to show me the ear canal, the middle ear, and the tympanic membrane. So let's just have a look. See, so if I get you to let's look ahead for me now. This is going to be a little bit cold on either side because it's metal. You can feel the cold, yes? Okay, good. If you can, let's turn your head a little bit this way for me. Good. Alrighty. And let's just have a look inside. Okay, so landmarks are perfectly clear. Cone of light is perfectly clear. And the middle ear, there is no sign of any fluid or redness. And looking at the tympanic membrane, that is intact and good to go. Okay, it's a few flakes kind of floating around, but nothing there that is untoward. Okay, that's cool. So I'm going to do exactly the same with the other side. So if you can turn your head just a little bit, so you're looking somewhere over there for me, and let's just have a look, see. Okay, that's good. Yeah, sorry, it's a little bit on the cold side. Okay, so ear canal perfectly clear, no fluid, no redness, and no edema. Okay, tympanic membrane is intact and in perfect condition. Okay, good. That's fine. 10 out of 10. You are doing well, my friend. So, let's just have a look on either side. Okay. Are you holding up? Good. All right, that's fine. So, let's see what the next test brings. So, here is a tuning fork. And what I'm going to do is, I'm going to pop this on top of your head, okay? And I want you to tell me whether the vibrational sound that you hear in either ear is roughly equal on either side. So, about equal on either side. Perfect, good. Okay, so what we'll do now is on each side, we're going to check your bone conduction and air conduction. Now the bone conduction, I just need to pop this right against the mastoid area on the one side. So there you go. And tell me when the sound goes away. Perfect. Good. Okay, we'll just check the air conduction. So, again, you'll hear the vibration. Tell me when you don't hear it anymore. Okay, so. That is perfect, good. So we should have a ratio of about 2 to 1 air conduction to bone conduction. So that is perfect, that's great. So I'm going to do exactly the same on the other side. Just going to pop this up against the back of your ear here. So again, oops, try again. Okay, and tell me when you can't hear the vibration anymore. All right, about now? Good, okay. So we'll try your air conduction. So again, same thing on this side, and tell me when you don't hear it anymore. Okay, we're just going to do that again. Good. That's fine. Yes, okay, so that is perfect. So we have a ratio of about 2 to 1 on either side, so your ears are absolutely perfect. Good for you. All right, so what we're going to do next is we're going to check out your nose. So what I'll get you to do is if you can tilt your head back just a little bit for me, and I'm just going to have a look up inside your nose to begin with. And okay, sorry, this is a little bit uncomfortable, but the mucosa is nice and pink. Yes, good. There is no septal deviation, which is excellent, and the terminates are fine. Okay, good. Just have a breather. That's great, good. So tilt your head back again for me. Okay, good. No edema, no redness, no flakiness, no sign of infection. Okay, that's good. So I'm just going to observe now the appearance of your nose. So I'm just going to have a look, see, and yeah, there's no deformity. Everything seems symmetrical. The skin looks good. So I'm just going to palpate the bone at the top here. Perfect. All right. And I'm going to now palpate the cartilage on either side of your nose. And what I'm doing is I'm feeling for any lumps or bumps or abnormalities on either side. Yeah. Yeah, that is perfect. Good for you. Okay, so I'm just going to have another look at this guy again. Just up your nose. So if you can tilt your head back, and this gives me just a more in-depth look at what's going on. So, there we go. And there are no lesions, no polyps. All right, good. That is perfect. So let's have a look now at the other side. If you want to just give your neck a bit of a crick. And if you look up again for me, and there you go, good. All right, and same thing. No lesions, no polyps that I can see. Okay, good. That, my friend, is perfect. Okay, you may be able to hear my dog snoring. It's very unprofessional, I know, having a dog in a doctor's office. But he's a Chihuahua, and he's very clean, and I had him disinfected before he went to sleep, so there's no chance of catching any germs or anything. And hearing him snore, sometimes relaxes you a little bit, so it makes the test a little bit less scary. I hope so anyway. So what I'll get you to do next is, if you can plug up one nostril for me, there you go, just on this side, and I'd like you to inhale. Yes, good for you. I'm going to do the other on the other side, so if you can plug one nostril for me and inhale. Yes, good for you. All right, that's fine. So, nose is looking good. So, what we'll do next is I'm just going to get you to tell me, we're going to do a smell test. So I'm going to bring this up to your nostril, and I'd like you to plug the one side for me, please, and tell me what this smell is. Peppermint, good, that's fine. And we shall do the other side, so if you can plug your nostril again for me and tell me what this smell is. Citrus, yeah, grapefruit. That's cool. All right, that's fine. So, ears are good. Nose is excellent. So what we'll do next is we'll have a look around the mouth cavity, and we'll check also your throat. So what I'd like you to do is open wide for me, and I'm just going to shine this light in your eyes just to have a look at your mouth cavity, just to see what's going on. Okay, good. Smile for me. Well, smile. If you can kind of show your teeth, bare your teeth for me like this. So yeah, good. So teeth are all white and even. No sign of distress on the teeth at all. Now I'm just going to pull down your lower lip like this. So I'm just going to pull that down just to check out the gums and the gingiva. Okay, good. Now, observing your lips from the outside, and they look symmetrical. You haven't had Botox done, have you? No, I didn't think so. Good. And no flakiness. Everything seems to be fine. No edema, no lesions, no cuts or anything. So they're looking good. So I'm just going to lift up now your upper lip, and just going to check the gingiva, your gums along the top, and we're going to check the frenulum. Just have a look with the light. So just lift up your upper lip. Yeah, frenulum is intact. Good. All right, that's fine. Good, good. Okay, so let's just have a look now a little bit further down your mouth cavity. So use this guy here. Don't worry, it's not going all the way down your throat. So I'm just going to get you to open wide for me. That's good. And if you can say ah, yeah, that's good. So say ah again for me. Yeah, see the soft palate elevates symmetrically, so that's looking good. And when did you have your tonsils out? 11 years old? Okay, that's great. Okay, good. All right, you don't need to say ah anymore, but ah if you can keep your mouth open for me. And I'm just going to have just look around just to check that the integrity of the mouth cavity is as it should be. Okay, good. Now, if you could lift your tongue up for me. There you go. So lift your tongue up. Frenulum is good. And everything is intact. Okay, that's excellent. Good. You can close your mouth now. So what I'm going to do next is I'm just going to have a feel around at the tissue inside your mouth just to check that everything is good to go. It looks fine, but sometimes when you have a good feel, you can feel any discrete lumps or bumps that shouldn't be there. So again, it's going to be a little bit uncomfortable, but if you open your mouth for me, and we're just going to have a feel on this one side. Okay. Just having a feel of the buccal membrane. And that feels nice and intact. Okay, good. So I'm going to do the same on the other side. So if you have a swallow, all right, that's good. So again, if you open your mouth for me and just have a feel around on the inside. Buccal membrane is good to go. And the gingiva is looking good. All right, that's fine. Good. So, if you can, once I get this depressive stick out of its packet, there we go. So, what I'd like you to do is, if you could say "ah" for me, and again, and once more. Yeah, perfect. Okay, so I'm just going to have a look a little bit further down your throat. So what I need to do is, I need to pop this thing on. And what this does is it gives me a good look at what's going on at the back of your throat. And it's handy if I need to take a bike ride home at the end of the clinic. So if I get you to open nice and wide for me, and let's see what's going on. Okay. And if you can say "ah" again for me, and just once more. Good. And once more. That's great. Okay. You did fantastically. Oops. You did very well, and everything is nice and healthy. Ears are working well. On either side, perfectly equally fine. Your mouth cavity, perfectly healthy. Hygiene is brilliant and on point. And your throat is looking very healthy. Nice pink, no lesions, nothing there to worry about. And your nose is nice and clear, no polyps, no lumps, bumps or anything, nothing to be worried about at all. So, you did good. And what we will do is, we will have you back the next time. So, but if you have any problems between now and then, of course, come back in. And if you enjoyed this examination, what I'd like you to do is, over here, there is a subscribe button. And I'd like you just to give that a punch, if you wouldn't mind. So, we'll see you again next time. Good to see you. Okay, so we're going to be checking your ears today. Now, I've been told you've got a little bit of redness, a little bit of itchiness and flakiness around the outside of your ears, and you can't hear as well as you used to be able to. Is that right? All right, let's get to it. So, what I'm going to do first is just to have a look, just to examine each ear once in turn. So if you can turn your head a little bit this way for me, see you looking somewhere over there, and I'm just going to just inspect the outer ear just to check how everything is doing. Yeah. Yeah, there's a little bit of flakiness there, a little bit of redness around the outer ear. I'm just going to press down on this bit too. That helps me a little bit, so let's just press down on either side. Good. Okay, let's have a look at the other side, and just going to be checking around the inside of the ear here. And we'll have a look behind the ear too, if you can turn your head just slightly, so you're looking over there for me. That's good. Keep looking at me. You can close your eyes if you want to. Okay, yeah, so you got a little bit of redness on the outside of each ear, a little bit of flakiness too, so let's see what we can do about that. So, first of all, what we'll do is we'll just check what you can hear. So what I want you to do is, if you can close your eyes for me, and what I'm going to do is I'm going to make a noise on either side of each ear, and what I'd like you to do is to tell me which ear you hear the noise from. Okay, so let's give that a go. If you close your eyes for me, there you go, good, and tell me which side you hear the noise. Good. All right, let's try that again. Excellent, good. One more time. Yeah, perfect. Okay, so this time what I'm going to do is the same thing. If you can keep your eyes closed for me. Now what I want you to do is I'm going to make a noise on either side of your ear, and you tell me when the noise stops, when you can't hear the noise anymore. Okay, so let's give that a go. Eyes shut. That's it, good. And if you can tell me just when the noise goes away. Yeah, that's good. Okay, so what I'm going to do next is I'm going to whisper some numbers in each ear, one in turn. And if you keep your eyes closed for me, I'm going to whisper numbers in each ear, and if you just repeat them back to me when I ask you to. Okay, so eyes shut. There you go. And I'm going to start on this side first. So 1, 59, 26. Okay, and if you repeat that back to me, yeah, good. All right, let's try the other side. And again, eyes shut for me. 15, 26, 100. Okay, repeat that back. Okay, we've got a bit of a problem just on this one side, the one ear. So, eyes closed again. Let's just double check. So, 37, 23, 82. If you repeat those back to me. Yeah, good. And again on this side, eyes shut. Good. And 17, 52. Yeah, okay, so I think what it is that we have a little bit of a waxy build-up just on this one side. So what I'm going to do is I'm just going to have a closer look at each ear in turn, and we're going to use this little guy here. It's called an oscilloscope, and just gives me a good look down each ear canal. So what I'll get you to do is if you can, as if you were yawning like this. If you open your jaw a little bit, as if you were yawning, and it just makes the ear canal a little bit bigger. So I'm just going to shine this in your one side. If you can move your head, see looking, that's it, somewhere over there for me. And we're just going to have a peek just down this one side. Uh-huh. Uh-huh. Okay, yeah. So, yeah, you got a little bit of waxy build-up in this one side, but the good thing is it's light in colour, which means that if it was dark in colour, it's been there a long, long time. So it looks as though it's been there not that long. So that should be quite easy to break down and to extract. But let's just have a look at your other ears. So if you can turn your head a little bit, just so you're looking over there for me. And again, same thing. I'm just going to shine this into your ear. So sorry the metal's a little bit cold, but you know, some people find that quite refreshing. Yeah. Okay. Uh-huh. Yeah, perfect. Yeah, good. So there's a tiny, tiny little bit of wax in this one ear, but this one is the one where we need to concentrate. So let's see what we can do about that. But before we do that, what I'm going to do is I'm just going to see if I can brush the flakes on your outer ear away, you know, just to brush those away for you. So again, turn your head a little bit this way, and just going to brush that for you. Okay, good. So look around the outer ear, and I'll just come more towards the center. Okay, perfect. You feeling okay? Yes? Okay, good. So, yeah, turn your head again. Let's get those last few flakes. Mm-hmm. Good. Mm-hmm. Okay, just a few more flakes just to get those away for you. Okay, perfect. All right, so do the same with the other side. Just use this brush, and if you can turn your head, so you're looking over there for me, just slightly 45-degree angle. There you go, and I'm just going to give that a bit of a brush. Good. Okay, good. And let's see if we can just get the behind the ears. So if you can turn your head just a little bit more, that'd be great. Good. And that's perfect. Good for you. Okay, good. Okay. All right, good. That's looking fine. So let's have a look at you. Yeah. Okay, turn your head. There you go. There you go. Some people think blowing's a little bit unprofessional, but I'm old school, so. Okay, good. So what we're going to do next is just to break up the wax on the inside of this one here on this side. We'll just put some drops. It's like an ear cleaning solution. It breaks up the wax, makes it much easier to extract. So we're going to use some drops here. So we're going to put some drops in each ear. Might as well do both while you are here. So again, just turn your head slightly for me. Okay, just make sure the syringe is full. And 1 drop, 2, 3, 4, and 5. Okay, good. Now, if you can do this on the outside of your ear, just push it and that's it, just tilt your head just to the one side, just for a second or two. There you go. And I'm just going to give that a massage just on that one side, just to make sure that the solution goes all the way down. Do you feel as though somebody's flooded your ear? Okay, good. Okay, you can bring your head back up now. Great. Okay, so we're going to do exactly the same with the other ear. So if you can kind of tilt your head just a little bit and point your nose somewhere over there, over my shoulder. Okay. So that's 1, 2, 3, and 4. Okay, good. Alright, tilt your head a little bit like this. Alright, just do that. That's great, good. Okay, let's give that a massage just to make sure the ear canal is nice and coated. Alright, that's perfect. Good, so we'll just give that a second or two just to start doing its thing. And while we're waiting for that, what I'm going to do is just to get those last bits of flakes just from the outside of your ears. So we're just going to brush again. So again, if you can turn your head so you're looking over this way, and this mops up the excess oil that may come out of your ears too. So look over there for me and see what we've got here. Okay, good. Oh, that's fine. Turn your head that way. Perfect. Good, 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 good. Okay. Excellent. Alright, that's fine. So, let me just have another look with my trusty oscilloscope, and let's see if that wax has been broken down. So if you can, again, just look over there for me. Alright, perfect, good. Mm-hmm. Yeah, that's fine, good. If you look over there for me, this one, this side wasn't much of a problem, so I don't expect there to be much there now. Yeah. Okay, right, that's good. So, let's see now. What I'm going to do is, I'm just going to extract the wax from this one side. Now I'm going to use this tool here, which looks a bit scary, but it's not really. You won't feel a thing, it doesn't hurt or anything, so again, just turn your head slightly for me, and I'm just going to be having a look down your canal. Okay, fine, good. Alright, turn your head just a little bit more for me. Okay, good. Okay. That side is now as clear as a bell. The sound a bit louder? Okay, good. Turn your head again and just do the same thing on the other side, although you don't have enough really in this here to be worried. Good. Let's give that a more. Okay, and that's great. So just double check now. We got all of that out, so if you can turn, there you go, good. Whoa, that is as clear can be. And again, turn your head for me. Yeah, clean as a whistle. Yeah, you're good. Alright, so let me just double check now the status of your hearing. So we're going to do the same that we did earlier on. So if you close your eyes, perfect, and tell me which side you hear the fingers. Good. Louder? Yeah, I'll bet it sounds louder. Yeah, that's good. Alright, I'm going to lean in and whisper, so tell me what numbers you hear. So 52, 22, 63. Spot on, good. And again, eyes shut. 21, 52, 59. Yeah. You are fine. So one more quick massage on either side, just to get rid of the last excess of the solution. And you, my friend, are good to go. All right, so I hope you're hearing better. Everything should seem a little bit louder now. When you get home, you might want to turn down the TV or the music, because everything's going to be a lot clearer now. So we will send you a follow-up appointment in 6 months' time. Any issues between now and then, just pop back in. And if you enjoyed today's ear exam, there is over here just a little bit of a subscribe button. So if you can hit that, subscribe, like this video, and we'll see you again next time. Thank you. Bye-bye. Okay, so tonight we're going to be doing an ASMR light trigger close-up video for you guys. We're going to be having a look at your face and your scalp and around your eyes and around your nose. Have a look into your mouth, and we're going to have a look at your ears as well, just to check that everything is okay. Does that sound good? All right, so we're going to get started. First of all, with a very, very basic pen torch like this. Now what I'm going to do to begin with is I'm just going to cover up your one eye. What I want you to do is to blink for me, please. Just once or twice. And blink again. And blink once more, just a little bit faster this time, like this. That's it. Good. All right. Perfect. Okay, and I'm just going to bring the light out just a little bit. If you could keep looking at the light for me. Okay, good. And again, keep looking at the light for me. That is perfect. Okay, so let's have a look at the other side. We'll have a look at the other side of your face, starting with your eyes. So if you could blink once or twice for me, please. Good, 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 good. And this time, if you could blink just a little bit more quickly for me. That's it. And again. And one more time for me, please. Okay. That is excellent. Good. So, I'm going to have a look at both of your eyes now, together with the pen torch. So if you could keep looking at the light for me, please. That's right. Just getting an idea of your pupillary reflex. Forgive my dog, just padding around in the background there. Okay, he's usually pretty well behaved, but you never know. Anything could happen. Okay, good. Okay. And if you can blink for me just once or twice, please. Okay, good. Mm-hmm. Mm-hmm. Yes, good. Okay. And if you could blink again a little bit more rapidly this time, that's great. Good for you. That's it. Like that. Good. Yeah, if you keep your head still, that's it. That is perfect. Good. All right. So this time, if you can look just at the bridge of my nose for me. And if you can blink as rapidly as you can, just like that. That's good. Okay. Excellent. 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 Okie doke. Good. All right, so what I'll get you to do now is if you can keep your head really still for me, just like that. Yep, that's perfectly cool. And what I want you to do is if you can look at the light for me, just with your eyes, if you can follow the light. Okay, so there you go, just follow the light for me. Oops. That's right, keep your head. That's it, good. Exactly. Still for me. Phew. It's very hot. Okay, good. Mm-hmm. Good. All right, good. So I'm going to bring the light in, and if you can keep looking at the light for me. And further away. Good, good, good. I'm just going to put my hands on your forehead here. I hope you don't mind. Just to keep your head nice and still. Okay, good. Keep looking at the light for me. And follow it back. Mm-hmm. And again, keep looking at the light. And follow it back. Good. All right, good. Keep looking at the light for me. And follow it back. That is as good as it gets. Well done. So, got me 2 pen torches here. One isn't working very well. So, what I want you to do, keep looking just at the bridge of my nose, just here. That's it, good. And I want you to tell me which of these 2 pen torches you see flashing. Okay, so keep looking at the bridge of my nose. Tell me which one flashes. Yes, good. Good. Yeah, tried to trick you, didn't work. Okay, good. Let's try another one. Okay, and again, which one flashes? Yeah, bridge of my nose, just here. That's it. No, I zone out all the time when I'm having stuff like this done, so don't worry. Perfect. That's good. Okay, so going to have a more general look now around your face, just to check the integrity of your skin and around your scalp and around your ears. So we're going to use a big light this time. So I'm going to come up really close. yeah, you can close your eyes if you want to, and just take a deep breath. Just relax, and I'm just going to have a closer look at your skin. Okay, good. Okay, I'm going to come in a little bit closer. If you can just kind of dip your chin a little bit for me. I'm just going to check your brows. Mm-hmm. Okay, good. Just checking the overall integrity of your facial skin. Good. Okay. There we go. Good. Okay, perfect. Okay, good. You are doing very, very well. You are the most excellent patient anybody could ask for. Okay, that's very good. Perfect. Alrighty, so what I'd like you to do now is if you could keep looking at the big light for me, and if you can follow the big light out. Good. Follow it back. Good. And again, back away if you follow the light. Good. And again, back in. And if you follow the light out again for me. And back in again. That's perfect. Okay. Yep. Healthiest face I've seen in a long time. If you can dip your chin, I'm just going to have a look at your scalp. So, oops. Right, try again. It's going to go on tippy toe and just have a look at your scalp line. Just to check the integrity of the skin and the hair. Just to check that everything is okay. Mm-hmm. Yeah, that's good. Okay, for the next bit, I'm just going to pop my glasses on just so I can get a good look up close. Whoops. So again, keep looking straight ahead for me. That's perfect, good. Okay, that's fine. Okay, now I'm going to move this light around just a little bit. So again, you've guessed it, if you can keep your head just as still as you can for me, as though you're looking straight ahead towards me, just at the bridge of my nose, and if you can follow the light for me. Okay. Keep following the light for me. That's fantastic. Good. Okay, perfect. Okay, so what we will do next, excuse me, it's very, very hot. Just have a look with this little guy. Now this is, if I can get it to work, there we go. This is what's called an oscilloscope. So I'm just going to have a look at the outer bit of your ear. So if I get you to turn your head just a little bit for me, just so you're looking somewhere over there. And I'm just going to shine this in your ear, just to the one side. Mm-hmm. Yeah, that's good. Okay, all right, good. If you can turn your head just the other way for me, just so you're looking somewhere over there. Excellent, good. Let's just have a look at the outside of your ears. And just have a look deeper inside your ear. Alrighty. Perfect. Good for you. Okay. Now, what I'd like you to do next is, what I want you to do is touch your nose for me, and now touch my finger. Very good. Now, if you can touch your nose and touch the light. Good. All right. So what we're going to do is I'm going to get you to follow the light around. I can get a pen light that works. There you go. And when I say touch nose, touch light, I'd like you to touch your nose and then touch the light wherever it may be. Okay, so let's start. If you touch your nose, touch the light. Good. Touch nose, touch light. 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 Okay, excellent. All right, so what we will do next is use an ophthalmoscope. There we go. This one's working, which is good. So I'm just going to have a closer look at the front of your eyes. Hope you don't mind me getting a little close, because it is very, very hot in here. Mm-hmm. Okay, good. And the other eye, if you can look straight ahead for me. Mm-hmm. Good. That is the healthiest pair of eyes I think I have ever seen. So, good for you. Okay, so, again, big light, if you can look at me, and if you tell me when the light goes off, okay? Yeah, good. And again, tell me when the light goes off. Yeah, that's excellent. Good for you. Okay. So, let's just have a general look again at the front of the cornea. So, I'm just going to have a fast look here. Okay. If you turn your head, we'll have a look at your scalp again. Just above your ears. Good. If you look over there for me. That is perfect. Good. Now to finish up with, we're just going to have a general look up close. Okay, with this guy here. Now this might be a little bit bright, but it gives me a good idea just of the overall state of things. Okay. Yeah, excellent. That is as good as it gets. That was your ASMR light trigger close-up experience. If you enjoyed this exam, there's a subscribe button just over here. Give it a press, and I'll love you forever. And we'll see you again next time. Bye-bye.